So what would you say to those who right now are skeptical because they do have reason to be? What are your thoughts about it? What would you say to them really?
I would say that this vaccine is done in the light. We know that these other things that I alluded to beforehand were done in the dark. We had to bring them to the light. Even the Henrietta Lacks with the genome for cervical cancer and so forth, these all had to be uncovered. Once we knew that there was a SARS-CoV-19 virus, that basically a vaccine was being worked on. So this was not done in the dark. So that's the first reason we should at least have some reassurance that this is above board. Number two, we know that the trials were not done solely on people of color. They were done in a broad based community and sampling pool of willing subjects. So, and it's also been touted by our politicians. So, anytime you hear politicians willing to take something, then you can pretty much be sure that it's not under the cover of darkness in terms of being something bad for us. But the main reason we as African heritage people need to take the vaccine is simply what our former President Obama says. When white America catches a cold, Black America gets pneumonia. And so we know that because of our predisposition to pre-existing factors such as obesity, hypertension, cardiac disease, sickle cell, cancer, that we are more likely to not only contract COVID-19, but also to have more serious morbidities and, in fact, mortality. So, just for our health, we need to consider seriously in mass taking this vaccine. The second reason we need to take the vaccine is basically because of income. We know that the majority of African heritage people are essential workers, whether it's in retail, whether it's in fast food restaurants, whether it is in healthcare as medical assistants and orderlies and so forth. We have to go to work. And so if we get the vaccine, we're more likely to be able to be employed consistently and healthy. We need the money. Black businesses are the most likely not to reopen because of the lack of income and being closed down. So the more quickly we can get up to snuff in terms of getting a vaccine and getting people with some form of herd immunity and vaccination, we can reopen our businesses safely. The third is education. Our children already have an educational gap. We are less likely to have access to the internet for homeschooling. We don't have tutors, and we have parents that aren't able to sit at home and oversee our children's homework. So we do need to get the vaccine so that our kids can go back to school, so that if they return home to multi-generational families, that they're not infecting the grandmothers and the great aunts and their parents who are in the home. Another reason we should get the vaccine is psychologically. Sitting around in fear, not knowing if you're going to be infected, if you're going to die, if someone that you love is going to be sick and affected, is damaging. So for our communities, we need to basically take the vaccine for our psychological well-being. And then lastly, which may not be as serious, but certainly can be a motivating factor for our younger African heritage people, get the vaccine so that you can return to your social life. I know you want to go to the clubs, you want to go to parties, you want to go to family gatherings, our churches, our cultural events. Getting the vaccine will get us back into a social milieu that will benefit everybody. So those are just a few of the reasons I think that we should seriously consider when it comes to getting the vaccine.